Conventional method to diagnose diabetes is to measure blood glucose level. When blood glucose is elevated, it means diabetes. However, in real life, early signs appear even before medical tests show diabetes. Increased thirst is the most common early sign of diabetes. Excess sugar in the blood pulls fluid from tissues, causing a feeling of thirst. Additionally, the body attempts to flush out excess glucose, leading to more frequent urination. Consequently, this creates a cycle of dehydration, urination, and thirst. Remarkably, almost 90% of patients newly diagnosed with diabetes experience increased thirst or urination. So, first symptom is thirst, and second logical symptom is frequent urination. But increased thirst is considered the earliest and most common symptom of diabetes. And sometimes patients describe it as a dry mouth. Third significant symptom is increased hunger. Since glucose, or sugar, is the body's primary energy source, its inability to enter cells due to insufficient insulin action causes constant energy deprivation in cells, leading to hunger. So, excessive thirst, excessive urination, and excessive hunger, a classical triad. Count as the classic trio of early diabetes symptoms, and in Latin known as polydipsia, polyuria, and polyphagia. Fourth symptom is tiredness and fatigue. People with diabetes also often experience fatigue, as their inability to use sugar for energy effectively leads to an overall feeling of tiredness. Fifth, a less known but important symptom is the development of dark velvety patches of skin, a condition known as Acanthosis nigricans. Commonly found in the armpits, neck, groin, and underarms, this condition is strongly associated with insulin resistance. Although the exact mechanism of Acanthosis nigricans is unclear, it is thought that high levels of insulin and insulin-like growth factors promote skin cell overgrowth. Notably, about 70% of people with diabetes also have these dark velvety skin patches. Unexplained weight loss in people with diabetes occurs despite an increased appetite and adequate food intake. This happens because the body cannot utilize glucose efficiently for energy, leading it to switch from glucose to burning muscles and fats as a primary energy source. As a result, the body consumes its own muscles and fats, leading to unexplained weight loss even when food intake is sufficient. However, weight loss predominantly occurs in two scenarios. It is more characteristic of type 1 diabetes, where there is an absence of insulin, or in the later stages of type 2 diabetes. In contrast, the early stages of type 2 diabetes are often associated with weight gain and obesity. This is because there is a direct causal relationship between type 2 diabetes and obesity, with obesity and weight gain often preceding the development of diabetes, rather than the other way around. To summarize, unexplained weight loss is a strong indicator of uncontrolled diabetes. Another early symptom is blurred vision. High blood glucose levels cause fluids to be drawn from various tissues into the bloodstream to dilute the glucose. This process also pulls fluid from the lenses of the eyes into the bloodstream, resulting in temporary blurred vision, which is often associated with high blood glucose levels. This symptom can be one of the very early signs of diabetes, even before other symptoms appear. While temporary blurred vision can become constant as diabetes progresses, it's important to note that in the context of early symptoms, it is not due to diabetic retinopathy, which is another diabetes-related cause of vision problems that typically occurs later.